Warm greetings from the High 10. It is Everyday Shenanigans on this Saturday, April 11th, 2020. I'd like to bring you information pertaining to the coronavirus, the pandemic, as most of you know, that is affecting our country at the moment. If you need verification for the storyline, please log on to Axios. U.S. passes Italy on recorded coronavirus deaths. The U.S. reported the highest coronavirus death toll in the world as of Saturday, per Johns Hopkins data. 18,860 Americans have died. The big picture. More than 1,000 people in the U.S. have died every day from COVID-19 since April 1st. China has reported fewer infections and deaths, but its reporting is encountering considerable skepticism. Hard-struck states like New York, Louisiana, and Illinois have passed their expected peak dates when demands for medical resources like hospital beds and ventilators would be at their highest points, per models by the University of Washington's Institute for Health Metrics and Evaluation. The death toll in New York, the epicenter of the virus in the U.S., surged to its highest one day total on Thursday, a record high for the third straight day, then lowered on Friday. Social distancing measures could bring the total projected death toll in the U.S. down to 60,000, a significant drop from earlier models that projected between 100,000 and 240,000 deaths, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said. African Americans, Native Americans, and Hispanics are more likely than others in the U.S. to be endangered by the coronavirus due to chronic health and conditions and the effects of economic inequality, Surgeon General Jerome Adams said on Friday. The other side, China's reported infections and deaths have been questioned by allies including Iran in recent days, the New York Times reports. The CIA had reportedly been warning the White House since February that China has understated its infection rates, per the Times. The bottom line, the U.S. missed the boat on the kind of swift, early response that would have been most effective against COVID-19 and has been scrambling to catch up ever since, Axios' Marisa Fernandez reports. Go deeper. Global coronavirus deaths surpass 100,000. It says the volume of content that exists around COVID-19 and its impact can be difficult to navigate. Mike Allen, the world's most wired reporter, wakes up at 4 a.m. so you don't have to, 7 days a week. The Axios AM newsletter analyzes the top stories of the day in one fast read. Okay. So it's just a lot of information in this article pertaining to this coronavirus. And right now it says U.S. coronavirus updates. U.S. passes Italy on reported fatalities with 20,000 dead. Okay. If you need verification for the story, please log on to Axios. It's AXIOS. So basically right now, this report is stating that U.S. has passed Italy in recorded coronavirus deaths and that Hispanics, African Americans, and Native Americans, American Indians, have a high risk of contracting the coronavirus. It is also being questioned if you can catch the coronavirus again after being infected with the virus. As of the moment, there is no proof that you cannot recontract the virus. So let's say you get the virus, you overcome it. There is no proof at the moment that you cannot get it again. And as I mentioned this in a previous video, I am curious to know if you can get it again, and how horrible would that be to go through all that suffering, especially if you were taken to the hospital, put on a ventilator. As you have seen, there are people who've been in the hospital 2 weeks, 3 weeks, and they did survive. Then you had those who did not survive. But imagine going through all that for 2 or 3 weeks in there on a ventilator, come out of there, come home, start to get healthy. Short time later, 5 months later, whichsoever, you get the virus again. This is an unknown virus. It's being studied. There are different small studies going on at the moment. and pertaining to animals and humans. I guess they're doing studies on both. We will see. But right now, I don't know about the government reopening April 30th or May 30th. Just keeping it real. Because now, if you're pinpointing African Americans and Hispanics and Native Americans as Indian Americans, American Indian, excuse me, then that's going to be a problem. Because we know that we have a higher demographic of races in certain areas of this country. And we have a lot of Hispanic people all over the U.S. We have African Americans in certain areas of the country. And we also have the American Indian population clustered in certain parts of the country. So now stats are saying us's are more affected by the virus. It just seems every other day there's something new about this virus. 1 minute is 60 plus, then it's underlying conditions, then it's children dying, all age groups dying, then it's people who allegedly didn't have any health care issues. Now it's black folks, Hispanics, and the American Indian. It just appears to be a no-win situation. Or as one commenter said, oh, it's a win if you don't get it. Yeah, we know that, smart tail, okay? Quit playing. But nonetheless, it is sad that every other day someone's dying, someone is contracting the virus, someone's fighting for their life, and now a certain group of people are more at risk for getting the coronavirus. I don't know what to say. I don't want to say what I really want to say, but it seems like every time something bad goes on, dealing with healthcare issues, dealing with the AIDS epidemic, HIV, poverty, black folks always in the running, top spot for being affected. And it's sad. It's truly sad. That's my sad commentary today. God bless you, America and abroad. I'm praying for all of you. Please stay safe. Like, share, subscribe. Drop your comments below. Praying for a miracle. Praying for a miracle. Wash your hands. Wear your gloves and masks when you are out. And when you return in, please wash your hands and wipe down your surfaces. Please stay safe out there, America. Hello, Shiny V. Hope you're doing well. Hope you're doing well. Charlie Hunt, how you doing? How you doing? Adams, how you doing? Send a shout out to some of you who comment often. Thanks a lot for your support. God bless all of you. And until the next update, this is Everyday Shenanigans. Bye-bye.